Hello, everyone. I'm Rendi Murphree, the epidemiologist and director of disease surveillance at the Mobile County Health Department, here on this Monday, December 7th, to talk to you about the impact of the COVID-19 pandemic on Mobile County. We generally start out with some worldwide numbers, so 67 million cases of COVID-19 with 1.5 million deaths. In the United States, nearly 15 million cases and 282,000 deaths. We're adding in the United States more than 1 million cases each week, 188 or so on average added each day in the U.S. right now, with about 2.1 thousand, about 2,100 deaths added weekly. In Alabama today, the number is just over 272,000, so more than 250,000 people in Alabama alone have been diagnosed with COVID-19. And we know those are just the ones that we know about. So in Alabama, about 3,000 to 4,000 added every day. Alabama has just under 4,000 deaths. In Mobile County today, we're reporting on 21,280 COVID-19 cases. These are confirmed or probable cases among residents of Mobile County. 312 were added yesterday, and that large number was due to a backlog of 251 positive antigen results from a single chain that was processed yesterday on December 6th. So these will be classified as probable cases. They're antigen test results, and they will forever be reported on December 6th, even though the test dates went from June, July through October. So we asked the state to process those over the weekend so that it would, not interfere with our view of cases reported during the week. So we've had a total of 382 Mobile County residents die with COVID-19. That was just an increase of 1 over yesterday. The cumulative number of people hospitalized with COVID-19, 2,743. That was an increase of 15 in one day. And the number of people in the hospital with COVID-19 on any given day yesterday was 118. That was up about 5. So we're hovering in, the 110s, low 120s on any given day, and we are hoping that that will start to come down soon. So our weekly expanded report came out today. And again, just note that, Mobile is adding almost 1,000 cases of COVID-19 on a weekly basis. I want to just sort of give you some things for comparison. So last week, 973 cases were reported. That was a 50% increase over the week before. So again, we're still within that 14-day window following gatherings around the Thanksgiving holiday. So we may still continue to see a very high number of cases reported each day because of the gatherings and the transmission that occurred the week of Thanksgiving. So a couple other things that I just wanted to point out. We're still seeing the highest number of cases reported in that older age category, 25 to 49, but the largest rate. So if you adjust for the population, then it's the highest rate of cases is in ages 18 to 24. So those are still the age groups that are really driving community transmission out there. And again, we are in what we consider an accelerated phase of widespread community transmission of COVID in Mobile County, in Alabama, and in most areas in the U.S. For hospitalizations in the weekly report, the number was 2,981. That was an increase of 126 in just 1 week. So in 1 week, we added 126 new COVID hospitalizations. 68% of those, or more than 2/3, are 50 or older, which means that about around 30% are less than 50 years old. It's notable that last week we had 2 COVID patients who were between the ages of 0 and 4 hospitalized, and 2 between the ages of 18 to 24. So I know we talk a lot about those that are most vulnerable to hospitalizations and deaths are people who are 50 or older, especially 65 and older, and those with with underlying medical conditions, immunosuppression, obesity, that sort of thing. But we do see hospitalizations and rarely deaths in the younger age categories. So last week we added 23 people between the age of 25 and 49 were hospitalized last week from COVID. The other thing with hospitalization that's looking a bit different in this peak compared to the distribution, if we think of it, of all of our cases combined, is that overall, so if we look at all 20 plus thousand cases and 3,000 hospitalizations, overall, about 44% of them are African American and about 40% are white. But if we look just at the 126 that were added last week, 62% are white and only 24% are African American. So the look or the demographics or are looking a little bit different with this peak than we have seen overall in the outbreak. And similarly, when we look at the number of people who have died with COVID, again, it has gone up. So 18 additional cases have been reported. Most of those, overwhelming majority, are in ages 65 and over. We had 3 that were between the age of 50 and 64, and 3 between the age of 25 and 49. So 3 people with COVID-19 between the age of 25 and 49 who died with COVID. So again, I'm not giving you this information to try to frighten you or scare you into doing things that we think will protect you. I'm just providing this information so that you have some context. Sometimes it's really easy for people to start feeling a little bit complacent. It's like, well, it won't happen to me, and it doesn't happen to people like me, and I don't know anybody that this has happened to them. But just to kind of explain that no race, no sex, no age group is immune from the effects of hospitalizations and deaths from COVID-19. Anyone can get infected, and anyone can transmit COVID to others without knowing it if they don't have symptoms. So our testing figures are still looking really good. We have plenty of people getting tested, plenty of testing capacity out there. If we look at our traditional public health surveillance, we have about an 8% test positive rate. So around 8% of all COVID tests are positive. But again, when we look at 2 or 3 locations that are reporting aggregate numbers to us, so these are places that aren't able to report through the electronic system in the same way that some of the PCR labs are able to, we see that they have upwards of, one of them reported a 22% positive rate. And this particular location has one testing facility in George County, Mississippi, and their rate is much higher than that. So we know that we have neighbors even with alarmingly high transmission. So when it comes to what's happening in schools, there was a 200% increase in the number of cases reported among schools last week, with 209 cases reported. 54 unique schools are reporting at least one new case, and 9 schools are in what we would consider outbreak status with 3 or more cases in school-aged students or faculty or staff. And again, we recognize that it's sometimes hard to tease out whether transmission is occurring in the schools or whether it's occurring, at sports practices after schools or at after-school activities, or maybe gatherings of school-aged children or teachers and parents that socialize together outside of the school setting. So when we talk about this, we try to say that we have outbreaks in school populations. All of the indicators are high for the risk of transmission at schools, with there being outbreaks, a lot of new cases, high percent of change over the number of cases compared to the last week, and again, that percent positive PCR test, all trending in the wrong direction. So let me just call out a couple of zip codes. When we look at the cases that have been reported between the 22nd, November 22nd and December 5th, so again, this would be the week of Thanksgiving, and now the 10 days or so following Thanksgiving, we're seeing the highest rates of new cases in Satsuma, and Saraland and Wilmer. So 36572, 36571, and 36587. All right. I talked on Friday a little bit about outbreaks in long-term care facilities. So they are looking better, but we still have, let's see, 9, 10, 11 long-term care facilities. We have cases in inmates at a large detention center. We have cases in staff members at another detention center. So any play and have outbreaks in other congregate settings. So just, any activity that occurs indoors is extremely high risk. Think about that, particularly in places where 6-foot distance and mask compliance is not ideal. Those, being indoors is a much riskier situation than if you are outdoors or, for making sure that you're staying 6 feet away from people who don't live in your household and wearing your mask when you're out and about. So maybe just a comment on the vaccine. So there was some information in the press that a local hospital has announced that they are set to receive a few thousand doses of vaccine. So we are, talking to the Alabama Department of Public Health every day, and the feds are still evaluating. So an advisory committee is doing sort of a regulatory review of the Pfizer vaccine data probably this week. Then a few other groups have to meet to look at safety and efficacy, availability, chain of cold chain, making sure that you can assure that it's shipped and maintained at the proper temperature. All of those things still are very much in the works, but we do think that there will be Pfizer vaccine in the state of Alabama sometime the 3rd or 4th week of December, and more to come on that, because the number of doses for the first round of shipment has been determined, and there are 15 hospitals in the state that will receive that first dose, but it's not as many doses as we had been told 3 weeks ago. 3 weeks ago, we were told we were getting 10 times more than we've been allocated here. So the feds and then the state health department makes decisions about those allocations. About the feds decide what states will get vaccine and how much, and then the state health department decides how those allocations will be distributed. So stay tuned for information on vaccine. For most of us, vaccine will not be available to us until far into 2021. So there are lots of questions about the safety of the vaccine. Should you take it? It's pretty new. Should we wait and see? And I trust FDA and the Centers for Disease Control and the Advisory Committee on Immunization Practices. If they review the data to say it works, it is safe, I will raise my hand and get in line to take the vaccine. I'm not saying that you have to do that, but we're counting on, a large number of healthcare providers, and particularly people who are at high risk of complications, to take the vaccine early if it is safe and efficacious, and so that we can start building that herd immunity that we need to protect the larger population. Let me see a couple other things here that came in either from the press or on Facebook. Already touched on that. When someone asking that, so the Alabama Department of Public Health publishes a dashboard on the number of cases in schools, in school-aged children, that are reported to the Department of Education. So the regional nurses that report data in aggregate to the Department of Education, and then the Department of Education shares that information with the Alabama State Health Department, the Alabama Department of Public Health, and they publish the public dashboard on K through 12 cases. Now, those are cases only in students. The Mobile County School System has their own public-facing website where they produce a report each day that speaks to the number of cases that they have in students. So anyone who wants to monitor can go there and look. I think at the time the media was asking me this question, the ADPH school dashboard was reporting only 23 cases in the past week in Mobile County schools. But when I went on the Mobile County School website and looked today, they reported 8 just on 12/4. So I think for the most accurate information, you probably should go to the Mobile County Public School System website and look at their reports on the number of cases and students for each school in that school district. Let's see, someone on here who had spoken with a local ambulance service that there is a national glove shortage, and that is true. There is a shortage on gloves, most all personal protective equipment, so masks, face shields, and gowns are in ample supply right now, but gloves are in shorter supply than those other things, which is why the CDC recommendations, when it comes out about administering vaccine, it will not include a recommendation to use gloves when administering the vaccine, to try to not further burden the glove supply. And the ambulance service mentioned to the media that the health department had been keeping them equipped with supplies that they have needed, and I am glad to hear that people appreciate that. When the federal stockpile was released and started shipping to states, then the state health department and emergency management agency would make available things in the strategic national stockpile like personal protective equipment. And our emergency preparedness coordinator, Erin Coker, and EMA, our emergency management agencies, have been working hand in hand since early April to try to request those supplies anytime that it was made available to us. So we have rented new warehouse space to try to store personal protective equipment so that if it's needed, that we will be able to assist. Now, in the summer, there were shortages all over the place, and so we were happy just to give PPE to whomever needed it. But now that the supply chains are opening back up, we're really expecting and relying on everyone to try to shore up your supplies. And should you find yourself in dire need of supplies, please call us, and we will do our best to assist you. I know Erin and Brittany and Tasha and myself and lots of other people have thrown stuff in the back of our car and dropped it off at EMS or nursing homes on our way home lots of times throughout this event, and we're very happy and feel fortunate to serve our community in that way. So let's see. The only other thing that I wanted to talk about.
I got a few.
Oh, okay. Let me just talk a little bit about travel. I just wanted to mention that CDC has published some new guidance on travel, and we're coming up on a pretty heavy travel season. First of all, there is a travel planner on the CDC website, so that if you are going someplace in the United States, you can enter the city and state, the location that you're going to, and you can get information to see if there are mandates or stay-at-home orders or restrictions on quarantine if you travel into that area. So please go to get your local browser, your smart speaker, to help you find the CDC travel planner if you do plan on going someplace, so that you can see if there are local restrictions that are different from what we do here. But here is what CDC is recommending for domestic travel. If you're traveling, consider getting tested with a viral test 1 to 3 days before your trip, and consider getting tested with a viral test 3 to 5 days after your trip. And after your trip, even if you're not able to get tested, reduce non-essential activities for a full 7 days after travel, even if your test is negative. So again, recommending testing 1 to 3 days before you travel and 3 to 5 days after you travel. And do all the other things that you need to do to protect yourself while you're traveling, right? try to go in your car instead of a bus or an airplane or a subway or a train. Wear your face mask, distance from people who aren't related or don't live with you. And then CDC further extends this to people doing international travel. Again, getting tested 1 to 3 days before your flight, 3 to 5 days after your flight, and to, avoid non-essential activities for the 7 to 10 days after you return from travel. And so just some testing guidelines for people who know that they're going to travel and have access to testing. Okay, Mark, what you got?
This is about the probable cases. I understand the relation to today's numbers, but it seems Mobile County processes a much higher rate of probable in relation to other counties and in relation to confirmed cases in Mobile County.
Yeah, thank you, Mark. So let me address that. We are very fortunate in Mobile County that one of the testing facilities that is responsible for reporting these antigen tests, they have 4 or 5 locations throughout the county and have been doing a great job of providing COVID testing, in the community. Long lines. I don't think they're testing on Saturday, Sunday anymore. I might be wrong about that, but we are so grateful to have good healthcare partners in the community that are out there, making sure there's enough testing for COVID, assisting us if we get into a bind. I have 3 or 4 private healthcare testing locations that I can call them if I get in a bind and say, hey, we've got somebody who needs to be admitted to a shelter tonight and they need a negative test. Can you help? And they have always pitched in, and we work well together to try to protect the community. Okay, sorry about that. So in this situation where we have several thousand tests being conducted each week in Mobile, that's why we are seeing more probable cases than in other jurisdictions, because this is a Mobile institution, a Mobile healthcare delivery agency, and they are doing a banged up job of trying to help Mobile protect themselves. They're reporting antigen test results to us. They're the rapid test, and that's why we have many more probable cases than other jurisdictions because of this situation we have with having this really good partner.
Did you mention that those within 25 to 49 age group had underlying medical conditions or not?
Okay. So let me go back to this. So, thank you, Mark. I think they're probably talking about the hospitalizations. So in general, someone has been paying attention for many, many months. For the most part, the people who are less than 50 who die have underlying medical conditions or other reasons for having a deleterious outcome with COVID-19. There are a few people who are under 50 who get ill and hospitalized, and yes, they too usually have some underlying medical condition that predisposes them to severe illness once they're infected with COVID. But I want to make sure people understand that things like asthma, like controlled diabetes, that obesity count as an underlying medical condition. Many people, if they have their blood pressure well managed, they might not think of that as an underlying medical condition. Or if they are in their 20s and their asthma is controlled with an inhaler, they maybe don't think about that being an underlying medical condition. So I just want to make sure, yes, most of the people less than 50 who have complications that requiring hospitalizations and deaths do have underlying medical condition. But again, I just want to make sure I don't sort of dilute the message here in that it could be apparently very healthy people that are getting infected with COVID and then ending up in the hospital. And that's why it's why I wear my mask, right? I never know in the grocery store if I become infected and I'm transmitting virus and don't know it. I don't know if the person next to me in line at the grocery or next to me at the nail salon has asthma or, managed diabetes or anything. So that's why I try to be extra careful when I'm out in the community and maintain that 6 foot of distance and wear my mask and wash my hands.
Do you know anything about monoclonal antibody transfusions?
Yes. So monoclonal antibody transfusions have begun in Mobile County. This is a very recent therapy that received FDA emergency use authorizations. It's a little tricky because it has to be given in infusion centers. So I know at least 2 hospitals in Mobile have been trying to work out where they could safely give monoclonal antibody transfusions for COVID to patients and keep them safe from and isolated from patients that need to continue receiving therapeutic infusions for other conditions.
One more.
Okay.
Should high school basketball be canceled since it's inside and not outside like football?
Yeah, so the question is about should high school basketball be postponed because it's indoors and it is a high contact sport. It is, it's my strong recommendation that indoor sports be postponed or very careful consideration given to those sports. It's important that kids continue to get education, so we want kids to be in school. If they don't have a good situation for getting instruction and continue to get school from home, I think we have some leeway with sports, and it would be prudent to not allow spectators in the stands. It would be prudent to minimize things like concession stands or things where people are bound to gather. And it would be my recommendation that it is safer not to have any indoor activity where a 6-foot distance cannot be maintained between people who don't live together. That's what the safer at home order states right now. A gathering is a gathering, and whether it's a football game or an indoor basketball game or a wedding or a funeral or a party or a parade or a lighting ceremony, those are all gatherings. Outdoors is better, fewer people is better, shorter is better. And right now, any event, any gathering where a 6-foot distance cannot be maintained is prohibited under the safer at home order. And like I said, it's not a good idea because of the risk of high transmission indoors and when you have so much skin on skin contact, face-to-face contact where you can transmit COVID. So unless there's anything else, Mark. All right. We will end for today, and we will pick it back up on Friday to tell you how we're doing for the week. Thank you, and y'all have a safe and healthy week.